All right, well, let's get started. I'm going to turn the floor over to Richard Holdman, who works at CDPHE, and he's going to be presenting on monitoring health concerns related to marijuana in Colorado and the updates to the report. Richard, I will stop sharing and let you start sharing.
All right, thank you for the intro.
Yeah.
All right, so I definitely met quite a few of you through that exercise we just did, so that's definitely a nice thing to be familiar with a few of the audience members before. But so I'm going to be presenting on our monitoring the health concerns related to marijuana in Colorado, and specifically this is our 2022 summary. I will just skip to the next slide to go over the objectives. So for those that don't know, I know quite a few people in this audience are familiar with what our program does. But for those that are new or don't know, I'll be providing a short overview of how the Colorado Department of Public Health and Environment monitors marijuana use and health effects. I'll also be showing our process of taking this surveillance data and scientific review information and how we translate that for public health messaging. And then I'm also going to share our recent trends of marijuana use and health effects from our 2022 report. So it's kind of going to be integrated throughout as I go through the different health topics and show you what we've done with our report this year.
And Richard, you don't look like you're in presenter mode, to me at least. If you want to, because we can see your notes.
Okay. Let me reshare. Jeez.
I know, I've done this 75
My first time using.
Still can't do it right.
Oh, here we go. That might be it. Share the PowerPoint instead of the screen.
It's still showing the notes, but if that's okay with you, that's okay with us.
Yeah,
Cool.
Everybody just might get a little preview of the action items that I sent. So those are all that's in the notes. The slide that's presenting is the starts with monitoring changes.
Yes.
Perfect. All right. So this is just a snippet from basically the legislation of how we're directed to do our job. So we're to monitor changes in drug use patterns, broken down by county and race and ethnicity, and the emerging science and medical information relevant to the health effects associated with marijuana use. So just to show a little bit more of where this comes from, this is the Colorado revised statute at the top. So just again, just a quick overview of what our program does related to monitoring the health concerns of marijuana. So we systematically review the scientific literature. We review public health surveillance data from quite a few sources, which I'll be showing you in this presentation. And then we also recommend public health related policies and surveillance activities from the scientific review and data findings. And then we also identify research gaps important to public health and present those on our website as well for everybody to see. And then the last thing, which is what I'm presenting today, is we have to produce a report every other year. And the audience for this report, I have listed below. This is the Colorado State Board of Health, the Colorado Department of Revenue, and then the Colorado General Assembly. So it's not for the public per se, since this is the audience that we're targeting specifically for this report. So just a little bit more about this biennial report. It initially started as a paper report that was pretty long in length and very burdensome to read, I'm sure, for most of the people on the Board of Health and all that don't have much time. So in 2018, we transitioned to making our website the report. So now it's marijuanahealthreport.colorado.gov. And then every 2 years will produce a summary. That used to be a long PDF, just basically showing the new changes or the important data findings since the last report was produced. And then this year was the first year we have transitioned to making our PDF now infographics. So taking all the information from our website and turning them into something that's a little more digestible for those audiences. Since they don't have much time to review it, they don't have the amount of time we'd want them to read, a 70-page PDF report. So we tried to condense that into a infographic report so they could get the important information as quickly as they need it. And then just another bit of info, our scientific review is updated quarterly. So our website is continuously being updated with the new scientific findings related to marijuana health effects. And then also our website and our biennial report are approved by the Retail Marijuana Public Health Advisory Committee. So that's a big group of basically marijuana professionals in all sorts of different fields. So lots of doctors, we've got public health representation, Poison Center as well. All right, so this is just showing how we break that down, how we break down monitoring marijuana into our two sections. We have our patterns of marijuana use, so that's our surveillance of public health data, mostly coming from surveys or health incident databases. And then we also have our emerging science and medical information, which is that Retail Marijuana Public Health Advisory Committee. And that consists of reviewing the current literature, developing these evidence and public health recommendations, and then also the research gaps. So this slide just shows how it all kind of integrates together, and it's a constant cycle of, we're receiving our data surveillance, we're reviewing the scientific literature, and that produces our reports, which then help us inform any changes or basically upgrades we need to do to our surveillance or scientific review. And then, on the side, I just mentioned that we also collaborate with federal, state, local consumers and other stakeholders. So we're getting information from hopefully everybody that needs to be heard related to marijuana use. So just another goal of what our program does is we're trying to translate what the scientific review tells us into public health. So our first step is developing evidence statements that convey the quality and quantity of scientific evidence behind a finding. So we're basically summarizing all the articles that we find that are under one specific health effect, and based on what the committee agrees, how they're rated in quality, and how their methods were of the scientific article. So then that forms our evidence statements. Those get translated into our public health statements, which help guide the development of evidence-based prevention and education campaigns. So here's just a quick example of that. Starting at the evidence statement level, that is the scientific language. We try to mimic what the scientific articles are saying, so we use the same language as those. Then our public health statements go down a little bit into 10th grade language, just a little more digestible for people in our field, in the public health field, which then previously, and still happens, but we're waiting for new people to be working at our sister department at the prevention services. But what happens there is they'll take our information and they'll make it into those public facing messaging. So that's at a 7th grade language reading level, just so hopefully as much as the public as possible can understand and take our information. So here's just a quick overview of our health data sources that we are currently reporting on in this report and also on our website. So you can see at the top, we have our behavioral risk factor surveillance survey. This is the adult marijuana use data source. and then you can see listed how the analysis is done, and then also what patterns we're getting from this data source on the far right side. And then second one down is our youth marijuana use survey. That's the Healthy Kids Colorado. And then we also have our new moms, so 16 and up, first time being pregnant, and that's the Pregnancy Risk Factor Surveillance System, or PRAMS. And then down at the bottom, those two data sources are separated, as these ones inform us of basically what's happening with the health outcomes. So these are the Colorado Hospital Association and Poison Center data sources. So that's going to be people that are presenting to the ED or stay at the hospital, and then those that are called into the Poison Center from being exposed to cannabis in some way. All right, so now I will start just going through our new findings from our 2022 report, starting with our adult marijuana use. So again, this is from our behavioral risk factor surveillance survey. This is done every year, telephone survey to adults 18 or older. And then this helps us determine the prevalence of substance use with weighted analysis, depending on what we're looking at, demographics or geographics as well. All right, so this busier slide than I usually like, but this is just to show how our infographics have turned out. So I split it up. The right side is the first page from our PDF, and then the right side, sorry, I got it backwards, but either way, it's split up 50-50 into our 2 pages of our Berthas findings for our infographic. So you can see here, we had to basically summarize. We chose our 9 most important or most drastic new data findings and presented those in a more reader-friendly format. So you can see in the bold, we state the important data finding, and then in the not bold language below, it just helps us explain a little bit more, add a few more details. So just a few important ones to point out here. 19% of adults reported consuming marijuana within the past month. 3.3% of adults drove after marijuana use, and this has been stable since 2014, so that is good. And then on the right side, you can see an example of a graph taken directly from our data dashboards, just to show the smoking marijuana remains the most prevalent method of use. That is the yellow line at the top, followed by the other ones below it. And I kind of wanted to just use this time too to recommend people to go to our website and go to our data dashboards to look at these in more detail. Like if you wanted to look at the method of use in more depth, you can go to our page, go to the Berthas specific data page, and you can actually click on this graph, move things around. You can see how each year compared. You can see how it's changed since legalization. And then also we do comparisons. I think it's every 2 years, and then also this year compared to the last. So you can see how those trends have been changing over time, basically, since marijuana was legalized, and also through events like COVID as well, that we point out those on our graphs. So we will keep moving on. I could obviously talk about all our findings for way too long since we have so many, but this is just an overview and try to focus too on how we changed into these infographics. So moving on to our youth marijuana use. This is our Healthy Kids Colorado survey. So every 2 years, this is self-reported by the kids in the school. And then it's a prevalence of substance use with weighted analysis, again, very similar to Berthas in that aspect. And then again, this is just showing our 2 pages from our infographic, showing our important data points that we wanted to point out for use among Colorado students, essentially. So a few of the important ones I wanted to point out. 13.3% of youth used marijuana within the past month, and this is a decrease from 20.6% in 2019. And we definitely had to include the graph here just to show that this decrease was seen in all the other substances as well. You can see the orange line is vapor products, right above marijuana. Sorry, the marijuana is the green line. Orange is vapor right above it, and then alcohol is the purple line on the top, with cigarettes being the yellow line that's kind of been steadily decreasing for a while now, which is great to see. Another thing that we wanted to point out as one of our major findings 2 years ago was that high school students had a massive increase in using THC concentrates and dabbing. So that was one of our major health concerns that we were trying to focus on, especially with prevention services. How do we decrease that, as there are health risks associated with that higher concentration, higher THC concentration product. Where is that finding? But here it is, 8.8% of youth use THC concentrate hash oil or waxes in the past month. And that has remained stable since 2019. So while it hasn't decreased, it hasn't increased. So we're happy to see that at least. And then, yeah, as they said, they'll be sending out this PowerPoint. So I encourage people to either read our full findings on this, go to our website and look at our full report there, or again, explore our data dashboards. So on this slide, this is where I just wanted to show how our scientific evidence review has turned into, or how we managed to fit it into an infographic format of basically 1 page per health topic. So we have 11 health topics on our scientific review side of things, with the first one being the adolescents and young adults. And so we wanted to basically portray our most important findings in a way that people could look at it and get all the information at once. So we managed to fit our findings paragraph, kind of like a summary at the top. We also included our research recommendations, as those don't usually fit in the same way that these statements will. So it was nice that we were able to include those on the same page as our public health statements. So everything can kind of be in one place. And then we chose to put our public health statements on our report, moving from how we used to use just our evidence statements, which ones were new, which ones had changed evidence level, which you can see at the bottom here on this slide. They are written out from substantial all the way down to insufficient. So we wanted to move, our public health statements are a little more comprehensive. They cover more topics that we have, and obviously they're the ones that are used to form those prevention or education campaigns. So we thought this was the best move. You can see on the right side, we included the scale, so you can easily identify which of these public health statements are at a substantial level, which means there's a lot of evidence behind them. So we have, we're basically saying that this is as close to possible as being like a true association. So just an example, the first substantial one is that there are treatments for marijuana addiction that can reduce use and dependence. So we know that if youth or adolescents do go get treatment for their marijuana use, they actually can reduce their use and dependence from marijuana. So again, similar to our data, definitely go look at these on our website or our report, since I won't spend the whole time reading through them all now. So just a summary of those two sections. There is a large percent of adult consumers that use daily or near daily. Marijuana use has not changed among youth, and it is similar to the national level. And unfortunately, we still are seeing that high amount of THC concentrate, hash oil, or wax is used among youth that we want to address still. So that brings us to our next topic area, which is the marijuana use and maternal and child health. So right now, this is just informed by our PRAM survey, so the Pregnancy Risk Assessment Monitoring. And this is an annual survey, self-reported through the mail and telephone. And this is women that have had a live birth in Colorado. So again, similar to the other ones, this is determining prevalence of substance use with that weighted analysis again. And for this one, our infographic is only 1 page. So I was able to fit it on the slide nicely. And you can see our 5 most important data findings that we wanted to portray in our report this year. So thankfully, marijuana use before, during, or after pregnancy has remained unchanged, and you can see that in the graph that we included. And let's see, other findings, sorry. And then the other thing I wanted to point out was that marijuana use during pregnancy is thankfully still less prevalent than alcohol use, more prevalent than e-cigarette or vaping use, and about the same as cigarette use. So pretty good to see that in there, even though of course we want it to be as minimal as possible. And this shows just an example again of our scientific review specifically to all our pregnancy and breastfeeding findings. So on this one, you can see how basically how the data and these findings can help come together and inform what the most important topic is to address with this population specifically. So you can see on this, for example, the only substantially rated one that we currently have is that maternal use of marijuana during pregnancy is strongly associated with infants being born small for gestational age. And then we do have, specific to the pregnancy and breastfeeding, we have a few biological evidence statements, which are simply saying that we do see that THC gets passed through the breast milk and through the placenta to the baby. And we're still trying to figure out basically how that affects the offspring. So as more evidence comes out, we'll be able to combine that and then help inform using our data of when women are using to try and combat and be the most effective at reducing use for these mothers. So just summary of our important findings from there. Marijuana use during pregnancy and breastfeeding has remained stable. And then again, it's lower than alcohol and about the same as cigarettes. All right, so this moves into our last section, which is those 2 data sources that I showed at the beginning that are related to our health outcomes. So this is our Colorado Hospital Association data source. This gives us emergency department or hospital discharges from participating hospitals all over Colorado. We do have a pretty good sample from each area, so it's not just focused on Denver hospitals. So we do get the quite a few regions covered with this. It gives us our crude rate of discharges per 100,000 discharges with a marijuana related billing code. And those are included in this slide showing any marijuana billing code. Then those are split up into use, abuse, dependence, or poisonings or adverse events. And then just a couple limitations to point out with this data source. These are billing codes, so those don't specifically tell us much about the visit that these patients went through. We don't know if marijuana was the sole reason they were there. It could have just been an incidental finding on a drug screen or something else. But we do have to take it for face level and use this data as best we can to try and estimate this prevalence of people going to the hospital. And then we also had an ICD transition in October 2015 of these billing codes. It was ICD 9 before, and now ICD-10, which has done a lot of improvements, but obviously it's hard to track between those as they're not the same. And there were a lot of changes. For instance, before they didn't have marijuana specific codes in ICD-9. So that was a big improvement that we saw. And then this shows our 2 pages from our report, our infographics for our hospital association findings. So on the left side, you can see the emergency department data points, and then on the right side are the hospital discharges with those billing codes. So importantly, this year, ED discharges with any marijuana-related billing code have decreased to the lowest rate since 2016. And then just to show you the numbers, we wrote them underneath. It used to be 600, or this year, sorry, it's 672 per 100,000 compared to 1,065 per 100,000 in 2016. So that is quite a significant drop. And then even though that's the good news, the unfortunate news is that the rate of children under the age of 6 with a marijuana-related poisoning billing code has remained stable. So unfortunately, it didn't decrease, which is obviously what we want to see, but thankfully it didn't increase either. So maybe there has been some impact on informing those parents to safe store their marijuana or whatever else might be leading these kids to come into the ED. And then on the right side, related to hospital discharges, those again have decreased, similar to the ED discharges in total numbers. However, the rate of children under the age of 6 with a marijuana-related billing code has actually increased for hospital discharges. So that's a little concerning, as that may mean while they're showing up to the ED and that rate remains stable, more of them are getting admitted to the hospital and needing more intensive care than just being watched in the ED. So that's definitely something to look out for and increase those efforts to stop kids from having these experiences. And then I included just a couple slides from our scientific review related to our health outcomes, just to give a couple examples of how we presented these. So this slide is showing our dose and drug interactions, health topics. So this is, our main point of this one is that people need to use caution when taking medications, as some do interact with marijuana and other interactions just haven't been studied yet or found. So that's important when you're taking prescription medications to know which ones do interact with cannabis, and talk to your doctor and hopefully have a good conversation, see what you can do about that. And then just a few other examples. This is also where we have our interaction with opioids, and then also THC levels from different exposures. So if you're consuming edibles, if you're smoking, if you're dabbing, how does that look in your blood compared to the other methods of use? And then this is almost to the end. This is just showing our injury related to marijuana use. So this does not have as much robust findings. You can see the first 2 public health statements are purely based on case report or case series. And this is related to those vaping devices exploding or causing burns of people. And then the other findings here, we have a section related to physical dating violence. So if using marijuana affects being the victim or the perpetrator of physical violence with your dating partner. And then we also, at the bottom part, which unfortunately are all rated mixed at this time, just showing basically that there's conflicting evidence of whether or not marijuana use is associated with increase of workplace, recreational, or other non-driving injuries. So unfortunately, the scientific evidence just isn't there to inform us one way or another right now. All right, and our last data source is our Rocky Mountain Poison and Drug Center. So this is a little bit different than the other ones, as it's specifically just a number of calls that they receive. So this is voluntary, self-reported. It's either by the parent or loved one of somebody that's having a bad reaction, or it's of the doctor that saw the patient come into the ED and then they report it to the poison center. So we have our just one-page infographic. This is the end of our report. And it just shows our important findings from the Rocky Mountain. We, of course, included the graph just showing how the numbers have increased over the years. And then the light, I guess, kind of teal color is specifically marijuana only, with the darker color underneath being marijuana plus other exposures at the same time. So you can see those have remained pretty much stable, whereas marijuana only has increased over the years. And the largest increases we're seeing, which we did annotate in the graph, is when the medical market opened and then the retail market in 2014. And then this does relate back to quite a few other findings. Unfortunately, the most reported calls are 5 years and under, related to edible products and unintentional. So those are the kids that are pretty much, we can assume, are getting into their parents' edibles and just eating them because they look like candy or cookies or, whatever it is. Kids are exploratory, so they like to put things in their mouth whenever they find them. So unfortunately, this is the outcome we're seeing from having more of those products out and about, basically. And then directly related to that, on our next slide is just our two public health statements related to these unintentional marijuana exposures in children. This is definitely one of our most important topics that we're trying to address. And thankfully, we do have the surveillance data and scientific research to back it up and show that marijuana access is strongly associated with more unintentional exposures in children, and these lead to hospitalizations. So that just shows how our data and scientific review come together and help support each other for a big health topic. So just to summarize that section, our reported poison center exposures are highest among those children 0 to 5, edible products and unintentional. We have seen a decrease in ED discharges with any marijuana-related code. However, we've also seen an increase in rate of children under the age of 8 with any marijuana-related code. So just to have a conclusion of, hopefully I got the points I wanted to across from our report, just showing that we do have a biennial report that has undergone quite a few changes over the years, from paper to our website to now summarizing that website in an infographic format. We've been trying to improve our ways of making our data and scientific review more digestible for these target audiences, while also summarizing a wide variety of cannabis use data and related health outcomes, which I hopefully portrayed in those busy slides of just, there's so much findings and research that we want to show. How do we show that in this format? And I definitely want to give a shout out to Elise too, because this was her big idea of changing to infographics, and it went over extremely well with our committee and other consumers of this report. So thank you, everybody. Here's my information. Definitely reach out if you have any questions or concerns. I did mean to include our website link on here, but thankfully Elise did send that in the chat on Zoom. So please visit our website to look at more of our data, more of our scientific review, and see how we took basically those massive data dashboards and tried to slim them down into these infographics. Right, now we'll open it up for questions.
Thank you so much, Richard. That was great. Feel free to drop questions into the chat or come off of mute and ask them directly. Otherwise, we also have a couple questions to bounce towards you guys. that Richard was curious about. All right, if you guys aren't feeling chatty yet, we'll inspire you. Oh, Jose, you've got a hand up, go ahead.
Yeah, great. Hey, you know, I haven't been to the website, but I will. So I really appreciate seeing this information. So those infographics are available to download as well on the website.
Yep.
Wonderful.
Yeah, it's a big PDF of all of them.
Wonderful. Yeah, I definitely want to get those out to a few key partners, make sure they're aware of them because they may not be aware that those are available. And that we're fantastic. And I do like that. I think that's a really smart idea because you're right. It can be very challenging for some folks, particularly if we want to people who are decision makers and they need a quick reference. It's just really hard for us to take the time ourselves and pull out the information. We may not be pulling out the most relevant info. So it really helps for you guys. And I think for anyone who's doing the data stuff to consider that you have a good handle on data, you can help put that infographic together so it's really meaningful versus if I were to look at a report and I could pull out certain things, but I might miss something as well. So I appreciate that extra effort you guys are going through to put the infographics together.
Yeah, thank you for those comments.
It looks like you got a couple questions popping up, Richard. So first off from Tim, how are THC potency levels tracked in the research? Do they impact any findings?
Yeah, unfortunately, that's something that we wish we could track more. Unfortunately, that is right now, we just kind of assume based on method of use. So if people are dabbing or using those products that we know have more THC concentration, that's how we can see that. But unfortunately, yeah, we don't have a way to track the THC levels because I know flowers increased over the year. So it'd be very interesting to see that data as well. But that's definitely something we're working on.
Awesome. And then some kudos from Julia. Elise dropped a link to the infographic summary. And then Tracy, you said that you use the data to recommend public health related policies. Can you give some examples and who makes the recommendation? Great question.
Yeah, so this information, we used to pass it on to the prevention services department, which then would turn those into our education campaigns that they were spread about the state a few years ago. Unfortunately, they haven't had the funding, so we really have had to prioritize and pick topics essentially that then the prevention services focus on, and that has been the unintentional exposures in children and then the dabbing as well. So those campaigns have gone, they're not as big statewide campaigns as they used to be, like the Responsibility Grows Here. That was, I think, our first one. And then we had like the More You Know campaign as well. And that was a pretty big one as well, just about, you know, responsible use, essentially, like know what you're doing when you're using marijuana. Essentially, don't just be a novice user. A few other examples. Sorry, I'm blanking right now. But we do go to actually like physician groups as well. We're coming out right now with our pregnancy and breastfeeding physician guidance. So that will just go more to specific like hospital partners. We'd also like to, back when we have somebody working with us in prevention services, hoping to do what we used to call like a hospital roadshow, where we'd go around to each of the local hospitals and just hold little education seminars to teach them more, you know, about the new marijuana findings, and basically teach doctors how to talk to patients, and, you know, what do we need to be getting from these people as they come in to their visits.
Awesome. Okay, any other last minute questions? Or I'm also going to screen share real fast and see if any of these questions speak to you guys, and if you have any responses that you want to share with Richard in response to these questions. So are there data or surveillance sources that you'd like CDPHE to collect? The biggest challenge, well, I think that's more a question for you, Richard, but the biggest challenge you face moving from infographics. And then how can this report be used for public facing materials, which I think you actually kind of touched on with that last question.
Yeah, that's good. But yeah, no, it actually was quite a big challenge moving to these infographics, just trying to slim it down and pick what's important. And how do you make it visually appealing too, which thankfully we didn't have to do all the work ourselves, as CDPHE has as the media person to help us form these. So that was nice.
All right. Any last questions before we wrap up? Great. Well, awesome. Thank you so much, Richard, for being here and for presenting today. We will send out a follow-up email with some action steps that you all can take to utilize this data, and then to connect with Richard and his team if you guys have any additional needs or questions. As always, just remember to continue sending data reports and findings. If you want to see them published in the SEOW newsletter, you can send them to that coordinator email to Junior. Remember to participate in our meeting feedback survey that I think Junior just dropped a link for. And then our next meeting will be May 18th from 9 to 10:30, and it will be on the SEOW EPI profiles. These have not been published yet, but by the time we get to the presentation in May, they will be. We're really excited. This is another really great aggregate data source. So we'll be excited to learn more about them. I think that's it for us. Thanks, everybody.